Welcome to the all viewers and well-wishers of the world. The purpose of my lecture is learn the knowledge from the word and return the knowledge to the word. Motto of my life is learn, earn and return. I have learned a lot, earned a lot. Now it's time to return a lot to the word. Topic of today is scabies. As one can see, these are the rashes and the lesions of the scabies which can be seen on the different body parts like this, and one should have the doubt of scabies that it can be seen on the hand and on the other parts of the body, mostly start from the hands. Now, introduction of the disease. The name Sarcoptes scabii derived from the Greek word sarx, which means flesh, coptein to smite or to cut, and the Latin scabire to scratch. Other name of the disease is 7-year itch. It is an itchy, contagious skin infestation by a tiny microscopic female mite, Sarcoptes scabii var canis hominis, an 8-legged microscopic mite, transmissible ectoparasite as it lives on the skin. Symptoms are itchiness and pimple-like rash. Usual onset is 2 to 6 weeks in the first infection, but it can be more rapidly occurring in case of second infection. Like syphilis, scabies is great imitator. Its clinical manifestation lead to the misdiagnosis. Now, causes of the disease are sarcoptic scabii mite, which spread by close contact. Risk factors are crowded living conditions, child care facilities, group homes, and prison, where the people live very close and they have close contact and spread is very much there. Diagnostic method based on the symptoms and the differential diagnosis diseases which mimics like this. These are seborrheic dermatitis, atopic dermatitis herpetiformis, and pediculosis. Medications which are used for this are permethrin, crotamidone, lindane, topical or ivermectin, orally sometime given. Frequency, it affects about 2.8% of the world population, and it is common in both sexes. As regard the structure and the morphology of the mite is oval in shape, ventrally flattened and dorsally convex like a tortoise like bodies, and have got multiple cuticular spines. It have got no eyes and respiratory organs. An anterior rostrum with chile and 4 pairs of the limbs is there. 2 pairs are in front and 2 pairs are behind like spider and the ticks. The male measures 0.2 millimeter in length while the female are 0.4 millimeter long. Here one can see the mite like the tortoise, and here one can see the front view of the male and the back view, and here one can see the size of the male, which is about 0.2 millimeter, and the size of the female, that is about 4 millimeter in size. Now, scabies in animals. Many domestic animals are infected, but by the different species of the mites, sarcoptic mengi, affecting the dogs, cats, pigs, horses, and other animals contagious to the humans as the zoonosis diseases. Bird mites have also been noted, seen in the gorillas also. It cannot complete their life cycle on the human because these are of different species. But they produce several itching, severe intensity, and secondary skin infection. As one can see, the dogs, the cats, the pigs, the horses, and the birds are all infected with this mite, but that is the mangy mite which cannot complete their life cycle in humans, but they are going to infect these animals. So these are the animal mite which is not going to complete their life cycle in a human. Now, history of the disease. Scabies has been observed in a human since ancient times, that is 494 BC. In 4th century BC, Aristotle reported it, and Arab physician Ibn Zohar was to describe the scabies mite also. Roman medical writer Aulus Cornelius Celsus named the disease scabies. In 17th century, etiology of the scabies was documented by Italian physician Gaio Vanni Cosimo Bonomo, and disease was first discovered by Italian biologist Jacinto Sestoni in 18th century. Sulfur-bearing ointment was used at that time for topical treatment of scabies. Here one can see the Aristotle, Ibn Zohar, and Aulus Cornelius Celsus, and Cosimo Bonomo, and Jacinto Sestoni, all which have a role in the history of this disease. Now, epidemiology. It is one of the three most disorders in children with ringworm and pyoderma. 1 to 10% of the global population is infected with scabies. All races are infected, and all social classes are prone to have this disease. In certain population, infection rate is as high as up to 50 to 80%. It is common in the both sexes. Young and old people are more commonly affected, and it is more in the developing world and the tropical climates. Now, cause of the disease is infection with female mite, Sarcoptes scabii var hominis. It is an ectoparasite. The mite burrows into the skin to live and deposit eggs in the epidermis of the human skin. The symptoms are due to an allergic reaction to the mites. Only 10 to 15 mites are involved in an infection. Now, risk factors. People with a weakened immune system due to any reason are very prone. In elderly, more risk of the severe form called Norwegian or crusted scabies is there. Crowded condition with frequent skin to skin contact between the people are also very prone. Hospitals, institutions, child care facilities, groups, nursing homes, and the prison congested with people are also the places where the disease is seen more. Areas with a lack of access to water have higher rates of the disease. Now, the real knowledge is to know the extent of one's ignorance. That is the saying of the great philosopher Confucius. Now, transmission of the disease or the spread. Infected persons or asymptomatic person can pass or spread the mite onto the others, and that is by different way Number one is direct close contact. Scabies is contagious, spread by the prolonged physical contact, that is, skin to skin, at least 10 minutes contact with an infected person is necessary. It starts at the wrist because of holding the hands, and contact must be prolonged. I have told you that 10 minutes or more through hand holding that can spread the mite to the other person non-infected. Healthcare workers contact scabies from patients. Reason is extended physical contact with the patient. By swimming in a public pool, one can have the infection by person with crusted scabies who has got the access to the swimming pool. Now, here one can see the mite, prolonged skin to skin contact, then contamination, and then occupational exposure with the physical contact with the patient, and transmission from person to person. Mites are found primarily in the fingers and the wrist, and the rashes, which is showing in the pink areas, that is able to spread the infection by direct physical contact and by indirect contact also to the other healthy person. Now, indirect contact is by sharing the fomites. Fomites are the things belonging of the infected person, like clothing, towels, and bedding, only if contaminated by the infected person. Mite remains viable for 2 to 5 days on an inanimate object. The third contact is the sexual contact. It spread to the sexual partners, bed partners, schoolmates, daycares, multiple sexual partners via the sexual intercourse, because there is skin to skin contact. As with the lice, a latex condom is ineffective to prevent this infection because mites migrate from the other sides than the sex organs. So the condom is going to protect from the sex organs, but the other areas can also spread the infection by this way. Now, the transmission is, as I have told you, direct contact, sexual contact, indirect contact via the fomites, then via the insects and the pet. I have told you, though they have the different kind of mite, which is mengi. Now, the pet spread is the fourth kind of spread. Usually not, because pets have different kind of the scabies mite called mengi, which can infect a human but cannot complete their life cycle in the human being coming from the animals. Mite dies in few days and does not reproduce. In close contact with the pet, mite can get under the skin and cause itching and skin irritation, but can't complete their life cycle. Mites cause itch for several days, but no need of treatment to kill the mites, but get the pet successfully treated so that it is not going to spread it to the human being. Now, the life cycle of the mite, incubation period is 2 to 6 weeks, first exposure, and 1 to 4 days after the reinfestation. Now, both male and female mites come on the surface at night for the honeymoon, and 10 to 15 mites mate on the skin surface. After mating, the male mate dies and the gravid female tunnel or excavate into the outermost layer, that is the stratum corneum of the host skin, that is epidermis of the host. By using her jaws and front legs, she lays 3 eggs per day in her 30 to 60 days lifetime. Once away from the human body, which is the real host of this mite dies in 48 to 72 hours. Now, just consider that the mating of the male and female is there, and they are having the honeymoon there, and that the female lays the eggs. And here one can also see the adult mites, which are just here adults, male and female, and lay eggs. Now, these eggs, through the molting pouch, reach to the skin and they become the larva, and the larva changes to the nymphs from developmental stages of nymphs 1 to 3, and ultimately they become adults, and adults again they just have their life, they do marry and they have the honeymoon, and the female become gravid, and female comes into the tunnel, and that is laying egg. Sometime the mating occurs in the molting pouch as the female reaches here and males come here, and they do have the mating, and they are going to have the female gravid is going to give the eggs, and ultimately the same procedure is going to happen again. Now, eggs hatch into the larva in 3 to 10 days, and larvae migrate to the skin surface and forming short burrows called molting pouches. I have shown you already. Larva in 2 to 3 days changes into the nymphs from nymph 1 to nymph 3, which in 1 week mature on the skin. These young mites become adults and move on the skin, and they make merry again. Now mating occurs again when the male mite penetrates into the molting pouch of the female mite. Impregnated female makes serpentine burrows in the stratum corneum, and they lay eggs there. Less than 10% of the eggs do result in the mature mite. So here one can see the eggs, that is 2 to 3 days to hatch. Larva is 6-legged. Nymph is proto-nymph and trito-nymph 8-legged, and they become adult. Male will mate with the female, and the male will then die. Female will burrow to the stratum corneum to lay eggs. So we can just see here the number 1 step. The female, she lays eggs and give the feces and other excreta there. Now, the female that lays eggs, the eggs through the molting pouch reach to the surface of the skin, and here these eggs changes into the larva, and the larva then changes into the nymph 1, and then nymph 1 changes into the nymph 3 ultimately, and then these become adult, and here they are male and female, and again they marry, and the female, gravid female or impregnated female, that burrows into the skin and that start laying eggs, and then egg changes to larva to nymph, and the adult again. Now, pathophysiology of the disease. Mite burrows into the skin using its mouth parts and front legs. In 25 to 60 minutes, mites spread across body or to the another host through the close physical contact. The burrows tracks are linear and clearly mosquito-like bites, that is diagnostic. The allergy type symptoms, itching, continue for some days and even for several weeks after all mites are killed. New lesions may appear after the mites are eradicated by the infestation with the new mites. Individuals already sensitized from a prior infestation develop the symptoms within hours, not after few days, as I have told you already. Nodular scabies have symptoms for weeks after mites have been killed. Symptoms remain there. Here one can see the burrows with the eggs and the female giving the eggs. So there is reaction to these eggs and the debris of the mites, the excreta of the mites and other things. And here one can see the infiltration from the lower epidermis and the microvasculature, immunoglobulins, complement components, coagulation factors, and the host proteases. They just go and takes part to cause the inflammation and the irritation, which is just in response to the eggs and the excreta and the different protein of the mite that is reactionary. Now, the symptoms are due to the allergic reaction of the host body to the mite proteins, mite eggs, and scibella, the packets of the feces. I have already shown you in the previous diagram. Allergic reaction is both of the delayed type 4 cell mediated 30 days after the infestation and immediate sometime antibody mediated type reaction. It involves IgE antibodies which mediate very rapid symptoms on reinfection. IgE is present in the serum and at site of the infection. Humans create antibodies to scabies mites which do kill some of them, but the rates of the scabies are negatively related to the temperature and positively related to the humidity.